In this next case, we will review endovascular embolization of a large ruptured thalamic AVM, grade 5, using Onyx embolic material. In this case, a 19-year-old female with sudden onset severe headache and altered mental status presents with an exam where she is awake, alert, oriented to person, place, and following commands without any focal deficits. The CT scan revealed IVH with no hydrocephalus, and the CT angiogram showed a large thalamic grade 5 arteriovenous malformation. Here is the CT showing interventricular hemorrhage in all ventricles, as well as the thalamic AVM. The CT angiogram again shows filling consistent with an AVM, as well as venous varices, with filling off of the posterior cerebral arteries predominantly. In this case, we elected to perform a right posterior cerebral approach via the left vertebral artery. Here is an injection in the cervical region showing a robust, large left vertebral artery. And here is an intracranial view showing the thalamic AVM with large venous varices. Once the microcatheter is in place in the distal PCA, we then begin to prep the catheter with DMSO, and now we're injecting Onyx. You can see that the Onyx is filling beautifully into the nidus. We continue to inject using a staccato technique, or sometimes we inject continuously depending on how the Onyx is filling the AVM and how the Onyx is leaving the catheter. Here we can see the Onyx selecting multiple branches in the nidus. We continue to generate a beautiful Onyx cast in this AVM. Again, we see more filling, and there's no filling right now into the venous phase, but we are starting to get some Onyx reflux. So we pause the injection to see if after the reflux we can then get forward flow of the Onyx. Once we feel we've injected to the maximum capacity or we have achieved the result we were looking for, we begin to remove the microcatheter. Occasionally the microcatheter can get stuck, and we then use slow tension to remove the microcatheter, or even sometimes we may inject some DMSO to break up the glue adherent to the catheter, causing the catheter to be stuck. Here's the final angiogram showing significant amount of venous phase and a marked reduction of the nidus.